Good afternoon, everyone, and welcome to our LinkedIn Live and YouTube Live event for every woman everywhere, envisioning the future of women's health. The Sixth Diagnostics Media Forum is brought to you by Roche Diagnostics, a division of Roche. My name is Juliana Chan, and I'm a science communicator and the CEO of Wild Type Media Group. I will be your moderator for today. Today, I have the distinct pleasure of having six women's health experts who come from all over the Asia Pacific, from Australia to Pakistan, Singapore, Indonesia, India, and Taiwan. Wow, we have a full house. Together, we will uncover and discuss the persistent barriers that stop women from receiving the healthcare that they deserve. We hope that this session will be watched by healthcare professionals, policymakers, educators, scientists, and allies everywhere who want to find solutions that improve health outcomes for women everywhere. Given that where we are located, we will also focus, of course, on the needs of women in the Asia Pacific. All right, without further ado, I would like to invite my panelists from panel one. Our first panel comprises of three incredible healthcare experts who will be discussing the cultural and social nuances influencing the advancement of women's health in the Asia Pacific. And let me introduce them and bring them up to the stream one by one. First, I'd like to invite Alison Rossiter, Managing Director of Roche Diagnostics Australia. How are you doing, Alison?
I'm very well, thank you. How are you?
Very good. Okay, moving on, I would like to invite Professor Zara Hassan, Professor of the Department of Pathology and Laboratory Medicine and Director of the Faculty of Health Sciences PhD program, the Aga Khan University. How are you, Professor Hassan?
I'm very well, Juliana, and thank you for inviting me on this important show.
And last but not least, we have our gentleman, Rohit Sagal, founder of the Voices Project. Thank you, Rohit, for joining us.
Thank you very much. It's a pleasure.
All right. So in 2023, a regional survey was conducted by Roche Diagnostics Asia Pacific to uncover the challenges and pressures women in the region face that prevent them from getting the health care that they need. So we will be discussing some of that results with all of you today. I think at this point, I just want to invite everyone to enter their questions in the comment below. So we will be pulling questions from the audience as we go along. So feel free, address it to all our speakers or one of our speakers. We look forward to hearing from you. But to bring everyone to a start, I would like to ask all our speakers today, how did you think or observe the COVID-19 pandemic to have widened the gap in accessing healthcare, particularly for women? Did you see any noticeable differences or did you see no difference? Maybe I'll ask Alison to give us her comments.
Yeah, thank you for the question. I'd say with access to general checkups and screening being deprioritized through COVID, because we know that the health systems are under extreme pressure, so we understand the reasons why. But a consequence of that means that severe disease and cancer and long-term conditions is now becoming more and more severe than it ever would have been if screening would have happened. And we see this across all the countries. We also call it the tsunami of cancer because we're now seeing that these people are presenting with cases that could have been prevented if we'd have screened. Now, with women tending to be the main carers in the family, they always put their children, or tend to always put their children and their husbands first, meaning they take the back seat and they put the priority on the people they feel need it most. So I think we need to now make screening a priority again, like it used to be pre-COVID.
Thanks very much, Alison. And Professor Hassan, how about you? What do you think and what did you notice during the COVID pandemic?
Thank you for asking. So, our laboratory was one of the first in Pakistan to set up COVID diagnostics. So, we were very involved in identifying cases in Pakistan. And the first thing we observed is that most of the tests that were received were from males. And our data analysis for 2022, in fact, shows us that only 35% of the tests were from females. And this impacted, as an example, that the reports of men having COVID. So that skews the data a little bit and helps us understand that to get information about diseases and prevalence, we actually need to have access to testing.
Thanks very much, Prof. Hassan and Rohit.
Well, I think I look at it this way, that some of the studies that we've done have shown that what COVID's been is a catalyst. It's brought to the forefront a tremendous amount of inequity in patient access and engagement in any case. And the fact that there's been more light being shown on this area brings to light Warren Buffett's line that you don't know who's been swimming naked until the tide washes out. And it's so true, isn't it? Because various health systems and ecosystems, patients, communities have really been shown to be really struggling at this time, and probably more exacerbated than ever, post-COVID times in particular.
Thanks very much, Rohit. So I think I'm going to send a question directly to Alison. What do you think are some of the major barriers that women face in receiving routine preventative care, such as screenings for cervical cancer? Of course, I'm asking you in light of some of the surveys that Roche has done, and also with regards to the Freedom to Be campaign, which Roche is also leading.
Yeah, thank you for the question. Fundamental gender disparities in diagnosis, treatment, and care delivered across the Asia Pacific region are sadly alive and well. And that is why we need to do something now to close that gap. Hence the campaign you just mentioned, which starts today, which is the Freedom to Be Every Woman. We've launched that at Roche Diagnostics because we want to get out there and we want to make a difference. And women in 2023, there's always pushing women to be women leaders, to make equal pay, women's rights. Yet from the survey you mentioned, we surveyed 3,000 people across 8 countries. And the results that come back are pretty staggering, actually, showing that women are still pressured by family and societal expectations of what age they should get married, whether they should or should not have children, whether they should or should not have a career. And so they're receiving conflicting messages. And then, as I mentioned in my comment earlier, women tend to be, and this has come through in the research as well, they're the carer. In Australia, I live in Australia, 60% of the carers are women. So women, again, are putting themselves second to their families. And I'm a mother myself. You always put your children first. But without you being healthy, you can't be the carer that you need to be. Some staggering facts. 90% of cervical cancer deaths happen in low to middle income countries. Cervical cancer is a cancer that's preventable and a cancer that we're hoping to actually eradicate in the next few years following the WHO guidelines. Yet 90% of the deaths are in low to middle income countries. And I think that's down to education. And the second point, and this really hurts me a lot, I'm a mother, I've got 3 children, and having a baby should be one of the best times of your life. So exciting, so remarkable. Yet preeclampsia occurs in 1 in 20 pregnancies, and preeclampsia is also something with a simple test you can treat and stop the potential death of mother and baby. And yet we're seeing mothers and babies die at what should be the most special time of their life. And just with a test, we can make a difference to this and we can stop this. So I would say we need to make a bigger focus on education, and we need to raise awareness to government, to policymakers, to doctors, and to patients and women and families all around the world, that we together, with the right education, we can make a difference and save their lives.
Thank you, Alison. That's very well said. I'm just going to change the format of our presentation to put all of us onto to show our designation. And thank you so much to someone, let's see who asked us. Patricia, who asked to see our names and our designations. Here you go. I've seen lots of questions coming in from the audience. Michelle, Bless, Denio, please keep them coming. We will try our best to answer all of them during this session. So just keep firing away. But moving on, I just want to ask a couple more questions to my speakers. And this is for Prof. Hassan. Prof. Hassan, could I ask you, how do we then put female patients at the center of healthcare? We say they are important. Of course, I'm a woman. I think I care about my health. But how can we then show that they are the center of healthcare?
Thank you. That's such an important question. And Alison made some great points. And I want to layer on the complexity of women finding time and for their health by adding the cost. There's an element of access to the testing, which is dependent on financial access in low resource setting, but also the kind of healthcare facilities that are available. They vary greatly. Um, you know, the kind of provision for health available in different countries varies between government and private sector. Diagnostic tests, if you are manifesting a disease or symptomatic, are expensive enough, but screening tests are therefore, perhaps not a priority because there needs to be awareness at multiple levels. One, that women's health must be prioritized, but how and why? So, cervical cancer, breast cancer, these are two cancers that are high even in Pakistan amongst women, and often they present late. And we do know that if diagnosed early, they can be managed, they're good prevention, but both are cancers, both involve screening that involve women to be aware of their bodies, to have an understanding of reproductive health. Perhaps, for cervical cancer, not just getting the pap smear, but understanding that an infection may be the cause, such as HPV. So these are all things that we need to bring up in terms of information to the public so that they are able to understand that it's important to prioritize them. Because at the end of the day, when people are paying out of pocket, they need to make choices. And as the people providing care, if there's a limited amount of resources, perhaps making sure that women's health screens and tests are one of those important priorities is something that we need to work towards.
Thank you, Prof. Hassan, and I'm sure we'll be hearing more from you after this when we have questions from the audience. If any of you have questions for Prof. Hassan, please leave them in the comments. We are now live on LinkedIn and live on YouTube. We will see your comments and bring them up to the screen. Okay, I've got just one last question before I go to the audience questions, and this is for Rohit. So, Rohit, you've done a lot of work in this sector. In your experience, what are the greatest issues or challenges that limit women's well being and freedom? This is a tough one. That's why I
Yeah.
sent it to you.
Thank you. I appreciate that. And I think Prof. Hassan and Alison have set the context really well. I think, look, the biggest challenge in stimulating behavioral change in Asian societies, particularly in matters of personal health and women's health, it's a bit of like being on a double-edged sword. It's overcoming and displacing existing norms, beliefs, preconceptions to what's considered a medical health problem and what's a reliable way or an acceptable way to prevent or treat a particular type of medical health problem. And this is particularly impactful when it comes to sexual and reproductive health. And let's say, reproductive health rights for women. Since a large amount of these preconceptions and taboos regarding SRH exist within the cultural paradigms of most Asian societies, it comes in between so much of policy shaping, but more importantly, policy distribution. So everything from the fear of being abandoned by one's husband and family in the case of tuberculosis testing is part of the whole stigmatization aspect. That how does this then start to become more of a norm and accepted nuance rather than a lot of virtue policies coming into play? So there has to be brave discussions, and I think as we've talked about it in various different forums, there has to be brave policy when it comes to women's rights, particularly in areas of preventable cancer, which is just so shocking that as of today, we're still sitting with the sort of statistics as Alison mentioned earlier.
Thank you, Rohit, for sharing on this very, very important topic. I think we have a bunch of questions coming up from the audience. I hope you can take some of them. They are all related to this topic about women's well-being and freedom. I've got one question from the audience. I'm just going to pull it up. And I was wondering if this could be taken perhaps by Alison. Thank you, Dinio Visser. I hope I did not mess your name. Dinio, thank you for asking us. Is there no other way pap smears can be done without it being so uncomfortable and invasive? So, Daniel, I share your thought. I just did my pap smear a couple of months ago. This is after an entire COVID pandemic of 3 years not getting one done. So, I would like to hear what Alison thinks. Is there anything we can do better?
Yeah, so we've just launched the self collect. So for some people, it's embarrassing, or you feel uncomfortable. But what we have now is a little bit like when you were doing a rapid antigen test during COVID, or a lateral flow test, where you put the swab yourself and then you do the test yourself, and you can see what the result is at your home. With this, certainly in Australia, you go to the doctors, you get a special tube, and similar to what we would do to collect a COVID sample, go to the washroom and you do the sample yourself. So you still have to insert the swab and take the sample, but you're doing it privately yourself in the bathroom. You then screw the lid back on and take it to the doctor, and it will go to the laboratory as it would do if the doctor was taking the sample. So it's still, if you find the actual taking of the sample uncomfortable, you still will get that a little bit, but at least the invasiveness and the privacy aspect has been addressed in this way. I hope that answers your question, and I hope it encourages you to go and get a check, because it's a few minutes of uncomfortableness will really be worth it in the end.
Totally agree with that. Thanks, Alison. I've got another nice question from Tina. I thought this question perhaps Prof. Hassan could take. How can we make these tests, which I presume are pap smears, how can we make these tests more accessible to everyone?
So the self-sampling, I'll make 2 points. One of them is what Alison described very nicely, that self-sampling is now going to be available, and we really look forward to making that available to our patients, to trying it out, because there is hesitation to present to the doctor. There's difficulty in accessing a doctor, and if you need to find a doctor to do that test, that is a problem. How can we make these tests more accessible? It's by getting more people involved in the network to support the diagnostics, the awareness. So one shouldn't actually have to come to a tertiary care facility to get the testing done. As soon as there is more educational awareness, there needs to be a system where we encourage, we educate, and perhaps through some women's health initiatives that do other things for women, like perhaps even family planning or reproductive support initiatives, if they were the kind of groups that would also help guide women in getting tested, that would expand the network of people that can support women and understand that diagnostics and screening for them regularly can be beneficial, so that they don't have to become symptomatic to come and get a test done for potential cancers.
Thanks, Prof. Hassan.
Sorry, can I just interrupt? I just want to say thank you. I totally agree with everything you just said there. But it's about education. So in Australia, we were the second country in the world to roll out HPV primary screening. And we changed the way that the screening happens. So now it's every 5 years. And we're just entering into our second 5-year cycle as of December last year. And still, in a country where you can get these tests readily available, and you would think it as quite a westernized country, we only have around a 60% uptake in testing. And so for me, it's about education and awareness of just this. I think in our minds, we think of it as uncomfortable, as per the previous question. We think of it as, oh, I'm scared, or maybe it's a religious reason or some other reason why we don't go and have this test. But we need to raise awareness, and we need to educate people that it's just a few minutes. We can do it now in the privacy of the bathroom ourselves, and it could potentially save your life. And it's that education piece that we've got to get across all the countries, to women and to their families, that the importance of this. People should not be dying of cervical cancer.
I think if I can sort of add to that, and this is a great, I think, a topic that's now come up. So thanks, Tina, for this question, because it's I think brought many issues to the fore. I'll pick up on what Alison and Prof. Hassan said, that I've always said this, that no woman is ever made the same, right? I mean, there are obviously access and, inabilities of access as well. There's studies, for instance, that we're involved in right now with the issues and the vulnerability of foreign domestic workers from Indonesia, Philippines, in Singapore, and the lack of access or the lack of awareness in the more official corridors of where you would expect that to happen. It's not happening in clinical environments. It's not going to happen in the next visit to the doctor. And even when it comes to personalized use, there's also the other angle, which is well, here's an interesting one. Personalized testing when it comes to HPV in certain countries is almost name and shame, because it does put you, in the case of any positive results, on a registry that puts it next to other things like HIV/AIDS and things like that. So, there has to be a way to try and look at what are the alternative roles of influencers, of enablers, and whether that's faith-based, whether that's religion. I think Alison mentioned that quite aptly, that there are community building efforts that need to be looked at if we want to have an equilibrium or an equalizing of access to all women.
Thank you, Rohit, for bringing up the point of religion and faith, because a lot of these faith leaders hold sway of large populations, and they can encourage the women in their congregation to take these tests, to get checked annually or more frequently. All right, I've got so many very good questions. I want to encourage all of you to keep sending us those questions, and I want to take one question from wow, I like this one. Let's see who this is from. Okay, it's anonymous. Because of their security setting, a LinkedIn user asked us, a lot of these not so fun facts point out to, let me mute one of your speakers. A lot of these not so fun facts point out towards the systemic change needed for making healthcare in women a priority. How are these steps taken at the grassroots level? Any partnerships or programs that can be talked about here? I think Rohit alluded to faith and religion being involved. There are multiple stakeholders in this story. Who wants to answer about how this is done in their country? I would love to hear how this is done in Australia from Alison, and maybe from Prof. Hassan, how it's done in Pakistan.
Shall I go first?
Of course, Alison, go ahead.
Yes. So in Australia, we're doing quite a lot with media, and we're trying to the topic I just raised then about awareness. And so we're working with patients and people who who've suffered with cervical cancer and who've come out the other side healthy and able to have children and all the things that a lot of people want in their life. And so it's about the raising awareness. So we are doing that. We're doing that a lot with on breakfast TV, on different interviews, in different levels of media. And so again, like I say, it's the raising awareness piece. The other thing that we're doing in Australia is working with the Indigenous population. It's such a big problem with our Indigenous and Torres Strait Islanders in Australia. And of course, that these people are not just in Australia. We also have Indigenous people in New Zealand and the islands, and often forgotten about when it comes to things like this. And with this self-collect now, it's more accessible for these populations to get tested and prevent such travesties that don't need to happen. And so that's some of the examples of what we're doing.
Alison, if I could maybe just follow up with another question, and this is again from another LinkedIn watcher, is about preeclampsia. What is holding back us from taking that test? Can this be addressed as part of prenatal checkups? What do you think about it?
Oh, for sure. We're working very hard. My point earlier, for me, this is so emotive that the most joyous time of your life, bringing your little baby into this world, and mother and baby don't always make it due to preeclampsia. This is not acceptable. We have got a test that can stop. It's 1 in 20 pregnancies. 1 in 20 pregnancies is a lot.
Wow.
And we have a blood test that can help prevent this. And the sad thing is, a lot of the symptoms are like high blood pressure and things that are quite normal or typical, and it's just catching them in time. So with our blood test, that we can rule it out or rule it in, so that we can make sure that you're treated in the right way to prevent such a disaster happening during the pregnancy for all. And so we are working closely with the government in Australia, working on reimbursement, working on awareness, and working on education to get this as part of every prenatal check, especially in those women who are at high risk.
Thanks, Alison, for answering this question. I've got a nice question I hope Prof. Hassan could maybe help give some light to. This is by Alina Rusu. Thanks, Alina, for the question, and also you thanked us for organizing this discussion. The feelings are mutual. She asks, I wonder how different countries plan for the HPV vaccination for young women. I thought maybe Prof. Hassan, if you could share how this is done in Pakistan, perhaps.
Okay, so awareness, testing, and vaccination for HPV in Pakistan is still in its early days. And for both things, it's the professional societies, the Obstetrics and Gynecology Society, who have been bringing up awareness at their annual conferences. And even now, they are conducting sessions as educational seminars for the public to inform them. So that's one way it's happening. It's still not part of government policy. So it is not part of routine vaccinations as yet, unfortunately. There are also limitations on availability of the vaccination. So hence the rollout of HPV vaccination is still limited. In fact, there's been I'm not sure they're completely available all over the country either. So with regard to both the testing and vaccination, these are things that unless they become part of policy and are initiated nationwide, it's still difficult to have it make an impact. But what we are trying to do now is to at least collect data, because one way to make the case for why something becomes important is, identification of rates of HPV and in different groups. And now there's some studies that are ongoing that will be describing that. And I think that'll be a step forward. So thank you.
Prof. Hassan, I've got another question. If you could hang in there for a bit. I thought you could answer this question by Tanu Bhatt. Tanu asks, menstrual problems are the biggest challenges faced by a woman in this hectic period. How can it be overcome in the future? I think she's asking a bigger question about, cramps, feeling ill during that period. How do we address that, and what is your points of view on that?
That's a very good question. That's related again to women accessing people who can help them with their reproductive issues. So they need to have access to doctors who can guide them.
All right, that's a very good answer. Always speak with your healthcare professional.
Could I just add to, I think it's linked in a way to this question and to the previous one on data, because I think that's a critical part that we have to recognize is probably one of the most challenging factors when it comes to the inequity angle of women's health. There's just not enough data. And that's why I think when you look at different statistics, it'll always show a higher skew towards men, towards the sort of studies, clinical trials, etc., that are always pushing it that way. Data collection, and particularly the access of data and ensuring that there is that amount of interpretation, is probably the most significant change since COVID. Because what COVID showed in that lockdown and sort of circuit breakers and everything else that we experienced is that the role of virtual and roles of technology really came to the fore. And if you think about everything we're experiencing now, this is partly, hopefully, a trajectory for the future where we can begin to have more personalized access, more personalized awareness, but more importantly, build a repository of data that can actually, hopefully, reduce some of the terrible statistics that we're facing today. And I think that was just a very important, factor.
Rohit, I have another question for you, and I think this is an important one. I think it's from Kirsten, but it doesn't show up, Kristen Sattler on LinkedIn. Kristen asks, what global organizations do the speakers recommend we support and follow to show our support for and get information about women's health advocacy around the world? For example, I follow and support the campaigns run by Global Citizen. I think Rohit, you'd be the best person to ask for this.
Um,
Any thoughts?
I think it'd be great to hear it from the panels as well, but I think there's two that I definitely always say a tremendous amount of effort. One is UICC, the Coalition on Cervical Cancer, that's doing an amazing
UICC.
UICC. They do some amazing work in collating a consensus, forming and converging different partnerships. It doesn't matter where you come from, there's always opportunities to learn. The second, and this is a shout out to Project Rose, Program Rose rather, in Malaysia, who are doing some amazing work in the personalized testing angle for HPV testing. And it's really hard in countries like Malaysia, and sort of finding ways that they can bridge policy discussions, government priorities, and of course the access points, I think are some amazing things. So I mean, like this, there are several. There's work that happens almost every day at the coalface. There's also the EBU network, which I don't have a specific handle on, but there's some great people even on Twitter and Reddit from Indonesia, part of the midwife network, who are again doing great work with very little support. So I think there's so much going on right now, but these are the ones that stand out in my head.
Can I
Thank you,
just add to
Rohit.
that?
Oh, please.
I think there's lots of great charities and support groups, and some are global, but some are local. And I think they're very, very good. And they will have people who've been through these situations, be it preeclampsia, be it cervical cancer, breast cancer, whatever it is, the topic of discussion. Also, the World Health Organization, they have some very good information too. And of course, I check out the Roche Diagnostics website, our campaign that we've launched today. So it's #EveryWoman campaign, freedom to be, #EveryWoman. And it's our goal to try and close this gap and make sure that every woman gets the testing that they need to be the best version of themselves. And that's something we're working very hard on. And we will do our best to get that education to every corner of the globe.
Thank you. I didn't expect Rohit to suggest Reddit, but you're right. There's a lot of grassroots level information. And Alison, of course, thanks for sharing with us about the Freedom to Be campaign by Roche. All right, moving on. I think there's still a couple more questions. We have maybe 5 to 10 minutes for more for this panel. Let's scroll down. Okay, I have some questions that are kind of similar and they're all grouped, but I'll choose one of them. Let's see. I've lost it. There's so many coming in. Okay, I have a question by Dr. Ratna Devi, and thank you, Ratna, for the question. Women are often not offered a full basket of choices by HCPs. I think here HCP stands for healthcare professionals. Judgments are made, well, sometimes based on literacy levels and ability to pay. So perhaps this is a problem that's faced in your country or where you live. So I think we may not be able to give the right answer for where you live, but maybe a broad answer. How can we then change this behavior? Is any of our speakers able to take this question? Maybe Dr. Professor Hassan could take this question.
I can thank you for the question, and it's such a big question because the first one is, who are the healthcare providers? Is it private? Is it government? Who is going to pay for the options? And does the individual patient completely understand the information being provided? That's something we see a lot, that where the patients may not be very well educated or even literate, they are unable to understand their choices. So it's very complex. Who can provide the choices? Who can take out the time to educate them for them to understand their choices? And then who will pay for the choices? These are all things that we really need to work towards expanding and increasing awareness about. Thank you.
Could I just add to that?
Please, Alison.
I totally agree with what Professor just said. And it's interesting. We have to work with governments, and we have to work with healthcare professionals, doctors, nurses, advisors, and we have to work with people who create the guidelines. Because there's guidelines for most diseases, and in the guidelines it's kind of a flow chart giving options: if this, then do that. And I remember when I'm from the UK originally, And in the UK, the government put out a campaign, "No decision about me without me." And I challenged that, and I said, well, hold on a minute. Are you talking to every patient and giving them every option, or are you making a judgment that that person may not be able to afford the test machine or whatever it was they were talking about? And I said, so how do we, perhaps I can't afford it, but perhaps my family will pay for it on my behalf. And so as Professor just explained, it's a really difficult subject, but it comes down to education and awareness. There's so many things on the market, maybe the healthcare professionals themselves aren't aware. So it's our job, I believe, to educate everybody, because education is key. And one thing that we've learned from COVID, and let's take the positives from the pandemic, is people are so much more aware of their health. Who knew that everybody could describe what a PCR test is, or a lateral flow test, or rapid antigen test? 2-3 years ago, most of the population wouldn't be able to answer that question, but now people know, and now people care, and now people are interested. And I think that should be the same for every illness and potential condition, not just infectious disease like COVID. And if we can get that level of awareness and that level of buy-in about your own health, I think the world will be in a much better place.
May I add something just on top of that? Is not just aware of the test, but now people have done their own tests, and that is so new. Because with the antigen tests, they had to swab themselves. There was a lot of hesitation, but people who'd never done a test learned to do one. So one can take that forward with other things. Thank you.
Definitely. You're right. We put the power into the hands of the patients. We allow them to be able to look after themselves. How many people wear a smartwatch and monitor their sleep with Aura rings and all the other gadgets out there? So people are more interested in being a healthy version, not just going to the doctors when you're sick. And that, again, I know I keep saying that E word, the education word, but I think it's vital.
I couldn't help but smile when I heard the word Aura ring. I want to move on. Thank you to Prof. Hassan and Alison for your points on cervical cancer screening. I want to move to a slightly different topic, and this time is about reproductive health. It's about pregnancy. I had a couple of comments in the comment feed about pregnant women. One person said pregnant women are mistreated in public clinics and hospitals. How can we make sure our healthcare professionals are really passionate about what they're doing and know how to help them? And I'm also going to bring up yet another question, which is similar. It's about thank you for your nice and kind words. The question from this LinkedIn user is, how can we help them to make the right choices about having kids, about pregnancy? Is it, employers? Is there any advice the group has, or any steps to have the support environment created? So I think the real question here is, how can we help women make good reproductive health decisions? And once they're pregnant, how can we support them in their pregnancy journey? I think the question maybe can be answered by Prof. Hassan, who may have seen some of these cases in Pakistan.
I haven't actually been involved in dealing with pregnancies directly. So, but generally speaking, again, it comes back to allowing women access to people who can guide them, who can provide them reproductive health, not just for family planning, but when they do become pregnant, to actually link them with people who can identify things like preeclampsia or other factors.
Thank you, Prof. Hassan. Rohit, have you seen that in any of your advocacy work in Singapore? By any chance, have you seen cases of where pregnancy and reproductive health education could be useful?
So I'll answer that in a slightly left field response. And since the question also comes from someone from South Africa, where I've spent some years on, I think that it's common. It's also linked to Dr. Devi's question before. There's absenteeism in this whole discussion. And I go back to what Alison said about the necessity for education. And I think what you mean is the innovation in education that we need to bring to the fore. The absenteeism here is insurance. The decisions that are made when it comes to financial aspects, or in cancer with financial toxicity, it's mind-boggling. And when you're already looking at gender inequity, already being perceived as a burden on the family and all those other sort of things, decisions are made on behalf of women, not by women. And I think there is this need to have the voice of insurance and providers to say, why aren't we here as part of the solution? Why do we appear and then disappear when it suits us? The casino can't always win, I'm sorry to say. There has to be a way that we get insurance to the table and, in a way, try and understand how do we bring greater awareness for things that matter, not for the things that are perhaps more economically beneficial. And until that happens, I fear there'll always be a gap in decision making and ultimately where we're hoping to see shifting the needle.
Thank you
I
so
just want
much,
to add,
Rohit.
I just want to add, I mentioned earlier about the survey we did. We surveyed 3,000 women across the Asia Pacific, across 8 countries in Asia Pacific. And I'm just reading the statistic here. 22% of the women surveyed felt unsure or not empowered to get medical treatment for child conception issues. Going back to the question that we were just asked, there's 22% of people, of women out there who don't even know where to go. And I
Wow.
think again that's quite concerning. So we need to help them, and we need to work with the governments, we need to work with the charities, we need to work with the doctors and the nurses, and maybe the schools. Like, let's start earlier. Let's educate women as when they're teenagers, so they can make choices. And choice maybe not to have a family until you're in your late 30s because you want to have your career first, or whatever that may be for you. But let's educate you on the choices that are available.
Very good. And Alison, that is actually a very good point to wrap up panel one. I think this topic of discussion, cultural and societal nuances influencing the advancements of women health in APEC. To all those of you who have been joining us this entire time, we have about 150 on LinkedIn, 20 on YouTube. Just want to say stick around because we have another panel coming up with more speakers talking about women's health. But in the meantime, I just want to say thank you, Alison Rossiter, Roche Diagnostics, Australia. Thank you, Prof. Hassan, um, Aga Khan University, and Rohit Sagal, the Voices Project Asia. Thank you for speaking with me today. Please stick around, of course, to the end, but I would like to thank you once more.
Thank you.
Thank you. All right. Let me Um, so thank you everyone for sticking around for panel one. I would like to move on to my second panel for today, and I'm delighted to introduce three experts from India, Indonesia, and Taiwan who will be discussing with me the topic of the right to universal healthcare, empowering women through healthcare access. Okay. Now I want to invite Murdu Gupta, and let me find her in my stream. Hello, Murdu. Welcome. Murdu is the CEO of KPAD. KPAD stands for Cancer Awareness, Prevention, and Early Detection Trust. Hi, Murdu. How are you doing?
I'm good, Juliana. Thank you. Thank you for
Thank you.
having me here.
And then next, I have Dr. Tofan Widya Utami. She's a oncologist and the General Secretary of the Indonesian Society of Gynecological Oncology. How are you doing, Dr. Tofan?
Yes, thank you very much. I'm very well, Juliana. Thank you very much for inviting me to this very valuable discussion forum. Thank you very much.
And then last but not least, we have Dr. Chen Ran Cho, Commissioner of the Department of Health, New Taipei City. How are you doing, Dr. Chen?
Hello, Juliana, and everyone on the screen. It's so nice to talk with you in this afternoon about the women's health and well-being.
Okay, I had to mute the fan so that it doesn't cause a distraction. So, in our second panel, and thank you, Dr. Chen, we will be discussing the types of barriers that prevent women from accessing the healthcare that they need, the need for, of course, autonomy over our reproductive health, and the role of education in overcoming stigma and in improving healthcare outcomes for women. So, for those of you who have been watching, I will be picking up some of your comments from earlier, but you can still leave new comments for for our speakers. And just to begin, I would like to start with Dr. Tofan. So, Dr. Tofan, from your experience, how can healthcare professionals help support their female patients better? As a gynae oncologist, I'm sure you have many thoughts on this topic.
Yeah, sure. Thank you, Juliana, for the question. I think it is a very interesting and also very challenging question. Yeah. In Indonesia, from according to our experience, yeah, we have a very much barriers, obstacles here. That's preventable and unpreventable challenges that we face. Yeah, patient with this issue that we have to. Provide the access, yeah, but the discussion is not providing the access only, but the more important things that we have to motivate how to encourage the women come to the access. So I think it fits very fits with the SDGs 3, yeah, 3.4, 3.7, and 3.8, that we have to decrease our premature mortality, and also for widens our access. So in Indonesia, the unpreventable challenges is in Indonesia is we're really a huge, a big population. We face women with age ranks 30 until 50 years old is minimal 32 million women that have to be screened. And also we have a very the biggest archipelago country in the world, that more than 17,000 islands with yeah, almost 8 million kilometers square. So it is unpreventable obstacles, unpreventable challenges that we face. But another things that we have some barriers. We have our own studies here in the six provinces that showing that lack of knowledge and awareness, and also lack of confidence in screening outcomes and quality also, and low risk perception until the permission from the husband. It is several factors that barriers and obstacles our accessing to go for screening for our women. So against that barriers to screening, it's not refer not only obstacles, but including beliefs and also attitudes of our women. So it is really complex and a very complicated answer to fit in your question. But the most important thing that we have to give a more effort to accelerate the educational background of our people here, and also for the husband here to go for screening. Thank you, Dr. Juliana.
Thank you, Dr. Tofan. Of course, we will be looking forward to hearing your insights about how healthcare for women is carried out in Indonesia. So, moving on, so every one of you in the audience, in the comments, please leave us some questions. You can direct them to all speakers or directly to Murdu, Dr. Tofan, or Dr. Chen. So, Murdu, I have a question for you, and I will be bringing you up to
Yes.
the hot seat. So, what impact do you think do societal and cultural norms have on the women today with regards to their rights to healthcare? And maybe you can tell us about your perspectives from India and what you see around you.
You're right. So, society has always had more control over um, a woman's life than we'd like to talk about. In India, especially, and from our experience, there are very little decisions that a woman makes on her own. It's
Mm,
always the larger the family has to make it. We are bound by what society wants. So it's not just her own personal issues. Of course, when it comes to cancer, or it comes to preventive care or health care of any kind, the woman has her own reservations. Of course, she has fear, she has lack of knowledge, she hasn't been exposed to what her options are. All of that comes into place, but so does social barriers. There is cultural issues with whether she can go and get her screening done on her own. Does she need somebody to support her? Does she have enough family support? And there is stigma with
mm,
almost all issues that she has. And then we also have structural barriers, we have system barriers. There is not adequate funding for women healthcare. I mean, these days when we talk about it, if a woman had to start a business, she would have certain concessions. There would be government policies around it. She would be supported. In India, if she was to buy land or even open a bank account, there would be some kind of government supports and considerations for her policies. but there is no female-centric healthcare structuring for her. If she had to look for support for treatment or diagnosis, or if she was diagnosed earlier, and eventually it would be a family decision of whether she could go out and get treatment. Unfortunately, in most cultures, the woman is the caregiver. And
Right.
on a priority list, the caregiver comes much lower than the breadwinner. So if a family has limited resource, they would choose to treat the breadwinner rather than the caregiver. So on multiple levels, the woman gets the brunt of it. So she's always low. Her priority of being treated is low. Her possibilities of access to healthcare is low. I remember a couple of years back, we were making a grid on funding women for cancer care, funding for cancer care actually, and we were putting together various criterias for how a person could be funded. There was age, there was the stage of the disease, and various things. And it turns out, if you look at the grid, that women over 55 have the lowest probability of being funded for cancer care. And at that time, I would tell myself that could be me in a couple of years.
Hmm.
That's so that's how we look at it. The role she plays in society, as well as the kind of control society has over her and her life, her decisions, is the reason why she is not being able to actually access healthcare the way she does. She has unmet needs. And I believe if that answers the question.
It does, Mridu. I've taken so many notes from your response. First of all, you said there's no female-centric healthcare and support. That's sad, of course, given that we have completely different biological systems that need different
Exactly.
care.
Yes.
And you mentioned about the breadwinner being emphasized over the caregiver, and I think that is true for many countries as well. Clearly, we need to support the source of
Yes.
income, of revenue. And then the last is that women over 55 have the lowest probability of cancer
That's right.
funding. This is a very huge source of uh, lack of
Absolute equity.
equality. Sorry, I'm tripping over
Yes.
myself because I don't even know what to say now. But thank you, Mridu, and I hope that people on the listening in will have comments for us. Please feel free to leave comments in the stream. You can direct them to any speaker, Dr. Tofan, Mridu, or Dr. Chen, or you can direct them to all of the speakers at the same time. So thank you, Mridu, for this, and I want to invite now Dr. Chen to answer a question, which is, I guess you can speak on behalf of Taiwan. How can governments and related stakeholders help women to be more in the know, to be more aware, to be more educated, and in control over their reproductive health and well being?
Thank you, Juliana. It is very important that government should focus and work together with the related stakeholders to improve women's health and well-being. Let me use cervical cancer as an example to answer your question. Because in our country, cervical cancer is still one of the 10 causes of cancer deaths among women. In Taiwan, through the government initiative and collaborations with all the stakeholders, um, using pap smear screening, HPV vaccination, which are free for the women and the girls, there have been significant achievement in cervical cancer prevention and control. For example, like pap smear testing. This publicly funded nationwide pap smear started since 1995. The women over 30 years old, they can receive the examination for free once a year. We recommend that they have at least once every 3 years. Now we have about 55 to 60% of women receive the examination at least once every 3 years. We do a lot of advocacy and increase the accessibilities, reduce the barrier for the woman. For example, we improve the awareness by advocacy through all the media, the TV, the newspapers, the new medias, etc. And we also do a lot of education. In the hospital and the clinics, we set the fast track screening services for the women and established the outpatient active reminder system to do the female-centered care for them. For the women who live in the countryside or small communities, we sent the mobile outreach vehicles. We sent the medical team and the facility to them to help them to receive the free pap smear screening. For HPV vaccination, the nationwide HPV vaccination started since 2019 in Taiwan, but actually we started earlier in New Taipei City. In New Taipei City, we started to give the free HPV vaccination since 2010. So right now we have more than 210,000 girls who received the vaccination. The coverage rate is very high. In nationwide, it's about 92% of the girls who are 13 years old received this vaccination last year, even in the COVID pandemic. How can we achieve that? Because we sent the medical team to the school. Most of them are in the school. So we do the vaccination in the campus. During the same time, because the medical team has already entered this campus, so they do the educations at the same time, including sexual health education and the risk evaluation of the vaccine, so that the girls know and the families knows the risk about the HPV. They understand through this communication. They receive the vaccination. It's about 92%. So it is very high, I believe. And using both of this, the incidence rate and the cancer deaths in Taiwan decreased year by year. So these are our experience of cervical cancer prevention and control. I believe that with this prospective policy planning and the government initiating to collaborate it with all the related stakeholders, it's a very useful towards the women's health. Thank you.
Thank you, Dr. Chen, for sharing with us how it is done in Taiwan. We look forward to hearing more comments from you. So I'll invite everyone tuning in on YouTube and LinkedIn to please leave us questions in the comments, and we will bring them up as we receive them. So at this point, I just want to bring up an old question that was asked earlier on. This is a question about what global organizations do the speakers recommend we follow and support to get information about women's health advocacy around the world. For example, I follow and support the campaigns run by Global Citizen. I thought Mridu maybe could share with us how someone in India could learn more, find out more, and support women's health there.
I think for general news on women's health, people should follow WHO because everybody uses their directives and they come up with regular information. Our platforms, all the CAPIT platforms, have the latest information on cervical cancer as well as on other cancers, women-related cancers. We do talk about them. We bring them up. We are constantly updating people in India so they know, because awareness and education is a large pillar of the work we do. Also, there is a network called the CCAE network, Cervical Cancer Action for Elimination Network.
Could you say that again? CCAE
network.
CCAE.
Cervical Cancer Action for Elimination.
Is this a global organization or regional?
Yes, it's a global one. But they have information and they have worked in various regions. So they have for Africa, they have for India, they have evidence-based information on what's happening, what the latest surveys are, and things like that related to cervical cancer, if you're looking for cervical cancer. So that's a good platform to follow. American Cancer Society has a lot of information. They work with CDC. They have information for India, for Sri Lanka, for Pakistan, and for certain countries in Africa. So South America also. So that's another platform that one can stay in touch with to get latest information. And these are platforms that are updated regularly. So you know what's the latest stuff, what is the Like the HPV vaccine, they are saying one dose is enough.
Mm.
The WHO has said it, and multiple other people have done studies. Path has done a study on it, and the other. So these are platforms that are keeping people updated. So if you're a layperson,
Thank
it
you,
would be
pass.
the best place to go.
I'm just going to mute that stream. And Murdu, I just was surprised because I always thought there was more than one dose, and now you're saying that the new consensus is one dose is enough.
Correct. It's still under WHO has suggested it, and there are lots of studies going on. In fact, currently we have a lot of talks happening with WHO and with CCAE and the others. They're talking about evidence on that single dose. Not too many countries have yet adopted it. It was just
Right.
announced in April. So I guess
I
people
see.
will still wait for a little more evidence-backed studies on it before countries adopt it. But yes, that's in the pipeline.
Thank you for sharing. I've got a very nice question from Tina. Thank you for supporting us and asking such incredibly good questions. And this is for Dr. Tofan, of course. Dr. Tofan, what are some of the ongoing efforts in Indonesia to raise awareness to women in the rural parts of the country? Are these scheduled health checks that these women are advised to adhere to? And if they are attached to a public health doctor in their locality? Thank you for sharing. So the question is, how can we help people in rural parts of Indonesia? Are there any way we can put them on a schedule, say annual checkups? And is there one doctor who can look after them for the entire life?
Yeah, thank you for the question. It's really important question. Yes, now Indonesia is really have acceleration, to accelerate any effort to disseminate the awareness, education, promotion about the cancer, particularly about the cervical cancer and the breast cancer. We know in Indonesia, cervical cancer is still one of the most gynecologic cancer that increased from 2018 to 2020, from 32,000 new cases to 36,000 cases, new cases. So according to your question, how Indonesia make this effort to disseminate awareness to women in the rural access. I think it is not only by district, only by the province, but we have to together do the collaboration, nationally integrated. Yeah. So we now propose to our government that should be collaboration among minimal 13 ministries in our government, such as, of course, Ministry of Health, Ministry of Women's Empowerment and Child Protection, Communication and Informatics, that showing the information how it's important to raising that cervical cancer is preventable and treatable disease, and also for internal affairs, education, culture, and also research and technology ministry, until Ministry of Human Development and Cultural Affairs, and etc. I think there are 13 ministry involved. So it is not simple at all, question to be answered, but we are moving forward to make the future for our women health, reproductive, mortality due to the cervical cancer decreasing. So and now we are in one of discussion to invite the governor, the 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 leader, yeah, the district um, uh, yeah, this district leader, to have some competition that patient and community with a very good awareness, it's as a winner, something like that. The innovative effort of our, it's just simple, but I think it is very very good to be implemented. So that's it is my answer. So I think it is
Wow,
really
Dr.
appreciated.
Tofan.
Yes.
When you said that 13 ministries are involved, I shuddered because that seems like a lot of coordination to be done, and of
Yes.
course, hundreds and hundreds of islands and
Yeah.
provinces and um, villages and cities and towns. So
Yes,
it
yes.
must be incredibly difficult. Yeah. I'm
Yes,
not
of
even
course.
sure how any government can wrangle all of that. Thank you for sharing your thoughts, Dr. Tofan.
Yeah,
I
yeah.
just
Thank
thought that
you.
we could maybe talk about another question, which is cost. I think I'm not sure who wants to answer this question because this is someone talking about the Philippines, but I believe it's also the same problem everywhere. Patricia, thank you for asking a question. This is from the YouTube site. The highest barriers for medicines in the Philippines is cost, and I think the same can be said of many other countries. How can the cost of life saving medicines be made more affordable in LMICs? I think LMICs might mean low and middle income countries. Does any of our speakers today want to address this question? This is a question on cost and accessibility.
Yeah, I think it is our problem. It is our
This
problem
Same
in low
problem.
middle income countries.
Yeah.
Even in Indonesia, just sharing. Let me sharing my our condition in Indonesia. Dr. Chan and Gupta. Yes, you know that from July 2020, Indonesia is moving to middle up income countries. Actually, from the
mm,
lower middle
No,
income countries. Yeah.
wonderful, wonderful.
Yes.
that's wonderful.
By World Bank from July 2020 is we're moving forward to middle up income countries. But in fact, our national budget for educational sector for health sector is not it's not fits with our status now. So I think the cost still very huge
It's huge.
problem here in Indonesia. But now we are very glad, we are very happy that our Ministry of Health and also our government now is really facilitative, yeah, in every good idea, very good yeah, some technology, even it is costly, but it is very fits with the evidence. It is very acceptable. So I think it's not just because the cost, but the willingness from the government to put
Yeah.
the health,
Mm,
yeah, the health sector as a first priority to maintain our health
correct.
for our people. Yes.
Thank you,
The
Dr.
fact is,
Tofan. How
yeah,
about you, Murdu? How
yeah.
about you? Tell us about India.
So I was going to say that yes, the cost of medicines is very high, and it's one of the biggest deterrents to people going ahead and even thinking about treatment. They just assume that this is a long term disease and we can't afford it, so they don't even get into it. It definitely requires a lot more than what we can do. It requires policy change, it requires government support. There needs to be insurance, some government schemes, some insurances that will have them avail. Of course, in India, we now have government schemes. We have the Ayushman Bharat scheme, that is a family insurance, health insurance scheme. It covers for the family. It has a cap for a year. But even so, in our data shows that of 1,000 women who may be detected with cervical cancer, only 10 will eventually get to treatment. Only 10 of
Wow.
them will get the advanced and high efficiency treatment. So that is the kind of dropout rate or the inaccessibility that we have. So yes, very high medicine cost is a barrier, I think, across most regions, and we are all trying to find a solution for it, but there is none that I can see that is sustainable. So if anybody gets a solution, please share it. We shall
So,
all use it for advocacy.
Murdu, can I just clarify what you just said? Is it that for 100 people who are diagnosed or detected with cervical cancer, only 10 get treatment? So
Thousand,
what happens? A
thousand.
thousand, sorry, I
Yeah,
misheard. So 1,000 leads to 10 getting treatment.
yeah,
So that means you're saying 1% of them get treatment. So
very
what
low.
happens to the other 90%? They just let that, I mean, the cancer just goes untreated?
So not all of them get the high efficiency. Yes, so India has, in India we lose one woman every 8 minutes to cervical cancer.
1 minute,
So
one per
that's a huge, one woman every eight
one
minutes.
woman every 8 minutes.
And it's not like we're not doing something about it, because when I started CAPID in 2014, our stats were we lose one woman every 7 minutes to cervical cancer.
I
9 years
see.
later, we say we lose one woman every 8 minutes to cervical cancer. So we are doing something, the country is doing something, it's just not enough. And yes, medicine, treatment, diagnostics, these are expensive costs. We need other methods of financing them. We need innovative finances for treatment and diagnosis of cancer. Otherwise, we will not be able to cover, to bridge this gap that exists. So thank
Thank
you
you
for
for sharing
asking this
this.
question, Patricia.
Yeah,
Very
and thank
important.
you, Mridu, for sharing these statistics. I've got another question about from Samantha Caitlin Yep. Thanks, Samantha. She asks, this is from the YouTube site, when it comes to women's health education, how young should governments and institutes look to targets? For example, should we start at teens, young adults? I think maybe we can ask Dr. Chen about that because she might have some experience of how it's done in Taiwan and in Taipei.
Yeah. Um, for example, we performed HPV vaccine for all the women, all the girls who are 13 years old. So during that
13.
time, 13, yeah. So even before they did not go to any obstetrics, during that time, we send the obstetrics to the campus to let them communicate it with each other. So let educated them, you can focus on your health, your own health, started from now, and you can go to the clinics or you can go everywhere to ask for the help. And we do a lot of education, but the education started when even they are in the preliminary schools, started since like 7 years old. So we have a lot of education programs during that time. We also work with the NGOs so that they can assess those girls who did not attend to the school, so they can have these educations or awareness through the NGO. Like we have Formosa Cancer Foundations to help the government with this.
Thank you, Dr. Chen, for sharing. Okay, I'm just going to we are just going to pull up a question that is slightly generic. So it's a very big question. It's very hard to answer, but I thought it'd be nice to end the panel with a question that was, proactive, optimistic, and something that we can control, we can do for ourselves, our sisters, our moms, our daughters, etc. So I just wanted to ask every of our panelists a question from Nirma Khan. Thanks, Nirma. Hello, everyone. Thank you for a wonderful session. How can a woman improve her health? I think this question could go everywhere from preventative care to getting screened and of course treated. Maybe we can start with maybe Dr. Tofan because I'm sure you've met with many parents, many moms and many daughters who have asked you a similar question before.
Yes, thank you very much for question. I think it's a really, yeah, really good a question. Definition of health is not as simple as we know. Yeah, it is comprised to not physical healthy, but with mentally healthy, of course. Yeah. So I think it is our big mission to maintain our women, especially in our community, to stay healthy with yeah, regardless the condition, with pandemic, without pandemic, or another barriers. So I think how can women improve her health? I think it is complex and a very very complicated sorry complicated answer. So I think um, the one of the system, yeah, health system, and our government and our leader is together have one unity mission, one goal, one target. So we have to give them the confidence to maintain their health, to improve the social economic status in the every woman that we promote. Yeah. So I think um, yeah, I think it is one again. It's not only women as individual people, individual one, but surrounding people, surrounding person to have to support the women to maintain the equality, the confidence or another. So one of the example in our people here, the paternalism is really strong influence that our women cannot decide, even it is certain life condition. So I think we have to sit together from the community leader to our government to our man to have this kind of purpose. Yeah, so I think it's
Thank
complex
you.
and complicated. Yes.
Thank you, Dr. Tofan. And then I thought I could maybe ask Murdu as well to wrap up this session. And thank you for being a panelist. How can a woman improve her health? It's a big question. You can answer it any way
Yeah.
you like.
It's a very wide question, but I'm going to take it literally. For
Hmm.
each one of us, prioritize your health. Know what you're going through, educate yourself, look out. There's enough information out there, read about it. Of course, it's not, Google isn't as good as a doctor, so you need to get to a healthcare professional. You need, no question is too small, and there is no reason to put it off, right? You
Yes.
have as much right to good health care as anybody else. So don't question yourself. If you feel you're not good enough, something is wrong with your system. If there's anything you need clarity for, you can demand good health care and you have the right to it. So I think the only way we can empower women, no one is coming to empower us. We've got to get up and do it. So please, just to improve your health and the health of women around you, make sure you speak up, make sure you keep yourself educated, keep yourself aware of whatever is happening in the world and with your body, and take action. I would say most important. Thank you.
Incredibly empowering. Thank you, Murdu. Empower yourself, educate yourself. There is no question that is too small. Just ask your
Yeah,
healthcare professional. And last
absolutely.
but
Yes,
not least, I'd like to ask Dr. Chen, any advice
totally
for
agree.
women
Yeah,
on
I
how to
totally
improve?
agree. I believe that the woman should put herself in the center for improve her life, to be educated and to communicate it and get help and empowered. But also I believe that the government should put them in the center too.
Too.
uh, we, government, the NGOs, the academia, and the media should also focus to help the woman to put them in the center. For example, like I said that for the cervical cancer prevention and control, now in Taiwan, we also do some pilot study, try to input the HPV test to the pap smear as a co-testing to especially help those girls, those women who did not appear to receive their free pap smear for 6 years.
Oh,
We believe
Wow.
that probably they can help themselves. So we have to help them to give them more
absolutely.
information.
Wonderful.
Once they come, we tell them, well, you are HPV positive, you are high risk. Then you should pay more attention. That's what we do. Thank you. Work together.
So,
Yes.
Dr. Chan, I just want to follow up on that question. If someone is diagnosed as positive for high risk HPV, what should they do next?
Well, we provided them to do the follow-up medical evaluations because in Taiwan, we have a national health insurance. The coverage rate is almost 100%. So
I
they
see.
can, yeah, once they get diagnosis, they can go to their medical part to receive every medication they need. But
I see.
a lot of women just did not pay any attention to themselves, so they did not attend to the pap smear. And once they appear, we give them the HPV test.
I see that's very helpful. And of course, um, we've come to the end of this session, and I wanted to thank all our speakers of panel two for discussing the topic of right to universal healthcare. I'm just going to use this opportunity and thank you, Dr. Chen, thank you, Dr. Tofan, and thank you, Murdu, to invite all of our other speakers to join us for a bit of a farewell. I have Ellison, I have Rohit, and of course, Professor Hassan. So thank you to my six terrific speakers. I'm just going to put them on the top. Yes, leave me in the middle and the bottom. I'd like to thank all my six terrific speakers for sharing their knowledge with us today. We've learned so much about the role of even faith, and religious organizations in helping us reach to demographics and communities we couldn't reach, the importance of reaching out to indigenous and rural populations. I've even heard statistics like we are losing one woman every 8 minutes to cervical cancer in some countries, to be actually a sign that more needs to be done. And I thank all six of you for joining me today for the sixth
Okay.
Roche Diagnostics Media Forum on the topic of women's healthcare. I hope that this will be a start of a deeper conversation around the healthcare needs of women in the Asia Pacific. So I'd like to give all of you a round of applause and thank you all of you for joining me.
Thank you.
So at
Thank
this
you.
point,
Thank
thank
you.
you.
Thank
Thank
you.
Thank
you.
you.
Thank you
Thank
so
you
much.
very
Thank
much.
you.
Thank you.
Bye.
At this
Bye.
point, I'd
Bye.
just like to invite everyone who is still around to tell us how this forum went. This is a QR code for you to share with us whether you enjoyed it, how we can do better. Please go ahead and scan the QR code, or if you happen to see it in the comments feed, you can also use that link instead. This Six Diagnostics Media Forum is brought to you by Roche Diagnostics, a division of Roche. We hope that all of you will stay in touch. And for more information, please visit us at www.rochediagram.com. Thank you once again to all my speakers. Thank you for joining me. And my name is Juliana Chan. I'm your moderator, and I'm signing out for today. Please have a great day ahead.
Bye, everybody.
Bye, everyone.
Bye, everyone.
Bye
Bye.
bye, everyone. Thank you very much for discussion.